Hey there, class. Welcome back. We are in chapter 16, and in this chapter, we're focusing on muscular and skeletal conditions and how to code them accurately using ICD-10-CM. We're going to see a lot of M codes, but also some conditions coded from other chapters like G, C, D, and Q codes. Because musculoskeletal issues can be neurologic, neoplastic, congenital, etc. in origin, right? By the end of this lesson, you should feel more confident navigating codes for joints, spine, soft tissue disorders, and pathogenic fractures, pathologic fractures, which can be tricky with coding. Here are the goals for chapter 16. First, you're going to learn how to code arthropathic conditions. That means joint-related disorders affecting muscles and connective tissue. Second, we're going to talk about dorsopathies and spondylopathies, which are conditions of the spine and of the joints. Third, we'll examine soft tissue disorders like bursitis, fibromyalgia, and tendon problems. Fourth, we're going to see conditions that impact the musculoskeletal system but are coded from other ICD-10-CM chapters, for example, muscular dystrophy and congenital deformities. Finally, we're going to focus on pathological fractures, which includes on how to choose the correct seventh character to show the correct episode of care. Some of the key terms on this slide are foundational for understanding the rest of this chapter. Arthropathy is a general term for disease of the joint. Articulation is simply a joint where two bones meet. You'll see terms like chondropathy, which is a cartilage disease, dorsopathy, disorders of the back, myopathy, muscle disease, and spondylopathy, which is related to the vertebral or spinal disorders. Laterality is important in the musculoskeletal chapter, right, left, or unspecified, so always check which side the condition is appearing on. So you want to double check on that documentation that the provider is noting in the medical record. Go ahead and keep these definitions handy because they're going to help you with decoding the language in the documentation that you'll be reviewing. Arthropathies are joint disease that may involve cartilage, synovial membrane, ligaments, and surrounding muscles. In ICD-10-CM, arthropathies are commonly found in the M00 to M25 range. Our focus today will be on distinguishing rheumatoid arthritis, osteoarthritis, and systemic conditions like lupus that impact joints. Think of it in terms of what's the underlying process. Is it an autoimmune degenerative disease? Is it post-traumatic? Or is it secondary to another condition? Rheumatoid arthritis is often referred to as RA. It is an autoimmune systemic inflammatory disease. It doesn't impact just one joint. It can involve multiple joints, plus tendons, ligaments, and even organs. The code categories you'll use most for rheumatoid arthritis are M05 for RA with rheumatoid factor and M06 for other types of RA. Documentation must clarify whether rheumatoid factor is present and which joints are involved. A common point of confusion: RA versus OA, osteoarthritis. Important to remember, RA is an autoimmune inflammatory process, whereas osteoarthritis is more about cartilage wear and tear and bone changes. So a lot of times we'll see osteoarthritis in knee joints and hip joints, some of the other major joints that take a lot of wear and tear in the body. When coding RA, always look for specific joint or region. Look for the laterality and whether disease is specified as seropositive or seronegative. Before you even open your coding book, before you even look for the code, always read the entire encounter. Look at the history, look at the exam, the assessment, and the plan. Identify the why of the encounter. What is the diagnosis? And the what? What are the procedures or treatments? If there's an injury or a poisoning, make sure that you capture external cause codes for the how and where when required. For musculoskeletal conditions, pay special attention to specific site laterality, acuity versus chronic. So is this a acute situation or is this a chronic situation? Is this a trauma or is this a non-traumatic event? Any underlying etiology. So it's really important to look for the needle in the haystack when you are assigning the ICD-10 CM codes. OA is a chronic degeneration condition of the articular cartilage when associated bone spur formation. Osteoarthritis can be primary idiopathic, where there's no real clear underlying cause. It can also be secondary, which is due to another condition such as prior injury or deformity. It can also be post-traumatic, which occurs after a documented injury. The examples provided in this slide show how specific the codes can be. Important to note the joint laterality and whether it's primary, secondary, or post-traumatic. When coding osteoarthritis, make sure that you review the documentation for which joint. Is it the right or left, whether it's unilateral or bilateral, and if it's related to an old injury or an underlying condition. Systemic lupus erythematosus, or SLE, is another autoimmune disease, and it can impact joints, skin, kidneys, brain, and other organs. Sometimes SLE is drug-induced, which is coded to M32.0. If the cause is not documented as drug-induced, we look at codes M32.1 for SLE with organ or system involvement. That means we must know which organ is impacted. So, really pay close attention to the documentation about nephritis, seborrheitis, skin lesions, or other specific organ damage. That gives you details on how to select the appropriate code. This is a great example of how musculoskeletal symptoms, joint pain, arthritis may be only one part of a multi-system condition. And you may have heard, but just within the news this past week, the Epstein-Barr virus, or EBV, is the virus that has been most strongly linked to lupus, as it appears to be a key environmental trigger that can initiate the autoimmune response in a genetically susceptible individual. So that's a big deal. That was just uncovered and published in research journals, that EBV is actually related to SLE. How that's going to impact the codes, we'll have to see how that lays out and how the codes may change or be addressed to be able to add that specific diagnosis in future code sets. Now we're going to move into the conditions of the spine, dorsopathies and spondylopathies. These conditions involve the vertebrae, the intervertebral disc, the ligaments, and surrounding tissues. With ICD-10, it's important to really get specific about the location. If it's cervical, thoracic, lumbar, sacral, or lumbar sacral, and often laterality when applicable. We're going to review the vertebral regions and then look at the specific conditions like kyphosis, scoliosis, ankylosing spondylitis, and disc infections. This slide reviews the segments of the vertebral column and their labels. So cervical is C1 to C7, that is your neck region. Thoracic is T1 to T12, which is the upper back and mid back where the ribs attach. Lumbar is L1 to L5, which is lower back and waist. The sacrum is S1 to S5, fused triangular bone just below the lumbar spine. The coccyx is the tailbone at the very end of the spine. When coding, always match the documented level, whether it's cervical, thoracic, sacral, lumbar, lumbosacral, etc. A lot of times we'll see the providers using shorthand like L4-5, disc disease. Make sure that you interpret that correctly and code the correct region. Now, kyphosis is an abnormal forward curvature of the spine. The example on the slide references postural kyphosis of the thoracic region. So it would be a forward region, so kind of leaning forward. Scoliosis is a sideways curvature of the spine, and it can be described as infantile, juvenile, or adolescent idiopathic scoliosis. So if you look at the person, so if you were looking at me, for example, my spine might be like that. It might go sideways. Or if you were looking at me sideways and I was leaning forward, that would be the kyphosis. So it's important to capture the correct documentation in the medical record. Make sure that you code accurately according to age of onset or type, region of the spine involved, as well as underlying etiology of scoliosis is secondary to another condition. Here we see additional spinal conditions you'll encounter in coding. Spinal ankylosis are conditions where segments of the spine are fused, which can be coded as M43.2. Ankylosing spondylitis is a chronic inflammation of the spine and sacroiliac joints, which is coded to M45. And it's another condition where careful attention to the region is important. Next, we have intervertebral disc infection, which is coded under M46.3 and may involve documentation of a pyrogenic infectious process. Always confirm the site, the cause, and the chronicity of the condition, and that will guide you with your final coding choice. Soft tissue disorders include muscles, tendons, ligaments, bursa, and fascia. Many of these conditions are common in outpatient and physical therapy settings. So coders, if you're coding in the outpatient setting, you're going to see a lot of that. We're going to look at pain syndromes like fibromyalgia, inflammatory muscle conditions like myositis, and localized problems such as bursitis and epicondylitis. Some of the key points you want to identify are which structure is affected and whether it's infectious or non-infectious, and confirm, of course, that laterality. Fibromyalgia, which codes to M79.7, is a chronic pain syndrome characterized by widespread musculoskeletal pain and fatigue, but there's no structural joint damage. Myositis refers to muscle inflammation, and some types are infectious, which will be coded under M60.0, and others are autoimmune. Polymyositis and dermatopolymyositis involve multiple muscles, and in dermatomyositis, the skin is also impacted. Dermatomyositis, derm, skin, and itis, inflammation. These conditions would fall under the code's category M33. When reviewing that documentation, look for whether the provider links the myositis to an infection, to an autoimmune disease, malignancy, or medication. Next, we have soft tissue disorders. The focus on this slide is on more localized soft tissue conditions. Epicondylitis is an inflammation around the elbow, the medial, often called golfer's elbow, or lateral tennis elbow, and that's coded under M77.0 or M77.1. Again, make sure that you follow that laterality. An Achilles tendon contracture can be an acquired condition, M67.0, or a congenital, Q66.89. Documentation must clarify whether it's acquired versus congenital in order to land in the correct chapter. Torticollis is a twisted neck position, coded to M43.6. Muscle spasms or cramps can also be coded with M62.83 or R25.2, depending on how they are documented. You want to always check whether the provider treats it as a primary muscular disorder or a symptom. Here we see conditions that impact bone and cartilage growth and remodeling. Osteochondrosis or osteochondropathy impacts bone and cartilage, with an example as Klein-Bach's disease of adults, which is coded to M93.1. Osteitis defermens or Paget's disease is coded to M88, and it's a chronic condition where bone remodeling is abnormal and it leads to bone deformities. Osteoporosis is split into two key groups, M80 for osteoporosis with a current pathological fracture, and M81 for osteoporosis without a current pathologic fracture. You want to make sure the documentation clearly states whether a current fracture is related to osteoporosis, or is this, related to a to an accident? Is this something that, if it is related to osteoporosis, this changes your code selection. Not all musculoskeletal conditions are coded from Chapter 13. Some actually originate in other body systems and are coded in Chapters C, D, G, and Q. This section emphasizes that coders must think beyond just the M codes, right? You want to think kind of more globally when you're dealing with muscles and bones. So, keep that in mind as you're going through the homework and answering the quiz, going through the quiz questions, that it's not always limited to that Chapter 13. So we're going to take a look at some acquired tumor-related conditions. We're going to look at neuromuscular disorders and congenital deformities. Muscle tumors are coded based on the behavior, whether it's a malignant tumor or benign. And then we have different terms here on this slide. Duchenne's muscular dystrophy, DMD, is coded to G71.0, which reflects its classification as a primary myopathy. Myasthenia gravis is a neuromuscular junction disorder coded to G70.00 or G70.01, and it depends on whether it's specified as in crisis. Paralytic syndromes such as cerebral palsy and hemiplegia or hemiparesis can also have profound musculoskeletal implications, even though they're coded in the nervous system chapter. When coding, you want to connect the neurologic or neoplastic diagnosis with its appropriate musculoskeletal manifestations, but obviously you want to code it from the correct chapter in the ICD-10 CM code book. Congenital disorders are present at birth and are coded from the Q chapter. Examples include congenital myopathies, G71.2, developmental dysplasia of the hip, limb reduction defects like ectromelia or hemimelia. There's also Klippel-Feil syndrome, which is Q76.1, and spina bifida. The key to distinguish between acquired versus congenital, here are some little tips for you. Congenital conditions often have lifelong implications and may coexist with later injuries or degenerative changes. You always want to look carefully at the history. If the problem is described as developmental or present since birth, this should prompt you to consider congenital codes. But if this is in reference to some sort of acute situation that happened more recently, then it is probably not a congenital condition. So next we're going to take a quick look at pathological fractures. And pathological fractures are fractures that occur in bones that are weakened by a disease process, and it's not necessarily caused by trauma. Fractures are coded from several different chapters. M84.4, 0.5, 0.6. You basically, when you're coding pathological fractures, you have to know why the bone is weak. You know, what caused that? Is it osteoporosis? Is it neoplastic disease? Is it another disease that has caused some sort of weakness in the bone? Documentation should clearly link that fracture to an underlying condition. If that link is not explicit in the documentation, it would be appropriate to query the provider or ask your supervisor or manager or coding colleague what they think about it, especially when you're just starting out. Now, these 7th characters describe the episode of care and healing status for a pathological fracture. An A 7th character is an active treatment. This is not about whether the provider is new or established, but whether the patient is still receiving an active fracture management. So say if I fractured my tibia, my distal tibia, I did a clean, I did a green stick fracture of my distal tibia, and I'm in an active fracture status. I was put in a cast, and I need to be in a cast for 8 weeks. That entire process of healing from start to the final phases of healing, when the fracture or the cast is removed, maybe I go to physical therapy, and then eventually, maybe 3 months down the road, I'm released from treatment. That would all be considered A. A D is a subsequent encounter for routine healing. So if I have routine healing after that A, that would be routine. Now, if there's delayed healing, that would be G, subsequent encounter for a non-union or a malunion. If I'm having problems with, healing of that fracture, then the 7th character matters. A sequela is used when there's late effects after the fracture is healed, such as chronic pain or deformity. Maybe I have 2 years down the road, I have a deformity in that tibia, that distal tibia where I had the fracture. Then that would be considered a 7th character of S. To wrap it all up, the musculoskeletal system includes muscles and bones that support the movement, the posture, and organ protection. The skeleton's 206 bones provide structural support and protection, and they're classified as long, short, flat, irregular, or sesamoid bones. All of these structures can be affected by congenital malformations, disease processes, or traumatic injuries. ICD-10 expects the coder to capture the site, the laterality, the etiology, and the episode of care. As you practice, continue to focus on carefully reading the documentation and matching it to the most specific code available. And we are at the end of our lecture, so I have one more lecture to do. And if you have any questions, please feel free to reach out. Thank you.